Hi everyone, welcome to V School, not Skin School, V School. It's a type of skin school for sure, but we wanted to dive in a little bit into, women's health and sexual health. And it's a more intimate round today, and it's a topic which interests all of us. So I invited two experts, two doctors, Kate and Evian, and welcome both of you. Thank you for joining us today.
Thanks so much for inviting me. This is great.
Yeah, I'm excited to be here.
Of course, thank you. You guys are in LA. Let's do like a quick intro. Maybe you guys introduce yourself, because you are so much full of facets in your work. So I don't want to miss out on anything. Maybe if you want to start, Evian.
Yeah. Hi, everyone. My name is Whitney. I am a sexuality doula and a sex educator. And through my work, what I do is I help women, femmes, non-binary folks step out of any sort of shame that they have with their sexuality, their body, their sexual identities, and into a form of sexual empowerment, sexual liberation. And I do that in various ways. I have a podcast called The Sexually Liberated Woman. I have a book coming out later on this year about sensuality. I have many pots on the burner, but my focus has always been about wanting to liberate folks within their sexuality and their bodies.
Cool. Kate?
Hi, everyone. I'm Dr. Kate Balestrieri. I'm a licensed clinical and forensic psychologist, a certified sex therapist, a certified sex addiction therapist, and a PACT trained couples therapist. And I really focus with all of the clinicians on my team in helping people find and uncover hidden pain points in their lives, specifically around relationships and sexuality, and move to a place of healing and then thriving in all kinds of areas of vitality. So that's my goal. And I do that also through many ways. I have a podcast called Modern Intimacy. I'm working on a few books, and then of course, clinical practice.
Amazing. So you guys have so much experience, and that is really great that we gather here together to really get like the focus in this area, and pairing it with what our skin needs, what our body needs, so how we can take care of this intimate area, what should we do, the do's and don'ts, maybe talking a little bit about youth or menopause, like which steps we are going through, what problems we are facing. I also would like everybody to encourage to just join our conversation. So normally we do after our conversation, like we're dialing in people. I would like, if you guys have questions, just jump in and unmute yourself, put your camera on if you want. If not, just type your questions and your comments into the chat. I think it's nice if we have like a really engaging conversation here. And I would like to start with, obviously you saw that we launched the V drops and the V wash, and that is a really important launch, I think, because our body has so many different areas where we need to put attention, whether it's the face, the body, our gut, our genitals, of course, also play a big role in our health, and lots of problems can occur in this area, whether it's from our hygiene, having too much sex or too little, or you're in menopause. I mean, so many things can start causing problems. Besides, we could be tempted to use the wrong hygiene products, whether it's something created for female hygiene, which could have too strong alcohol or perfumes and fragrances in it, or if it's just a normal soap which is lying around somewhere or in a hotel room and destroy or disbalance your pH in these areas. And I think if we could keep this area healthy by using the right ingredients, we could avoid a lot of problems, whether it's UTIs, candida, itchiness, whatever it could be. It could come from so many things in our lifestyle, and one of these areas we addressed with the V wash and the V drops to really keep this area in the right pH, keep the microbiome intact, keep the hydration level intact, and keep like this environment so healthy that we just can avoid any, type, or make it better, any type of problems. So maybe you guys want to jump in and tell me your experience in this area, and why do you think it's necessary to have proper hygiene, and what do you recommend, not just about products, but maybe also how often do we need to change our clothes? What do we do after sex? Some people just don't know that it's important to go to the bathroom after having sex and wash your intimate area to avoid UTIs. Yeah. You want to start, Kate?
Sure. Yeah, I can speak a little bit to that. Most people aren't given any instructions about how to be sexual or how to prepare for being sexual or debrief after. And when I say debrief, I'm including cleanup in that. So it's definitely helpful to rinse off, to clean, to make sure to urinate so that you can avoid things like getting a UTI, because during sex, there's a lot of bacteria that gets moved around and a lot of moisture. And so sometimes that can get into different crevices. It can get into the urethra, and there can be opportunity for infection if we don't flush that out. So it's a really great rule of thumb to try to go to the bathroom after, have a rinse or a shower, and really kind of pay attention to things going from front to back instead of back to front during sex. Yeah.
Yeah, I can add to that. I think that what's coming up for me around this conversation is wanting to bring in the reality that for a lot of us, we haven't had or don't have a relationship with our vulvas and our vaginas. Yes. And like to the extent that I'm remembering a client that I worked with a couple of years ago, and she was in her 50s. And I asked her, when was the last time you took a mirror and put it between your legs and saw what you looked like? And she's like, it's been 25 years. I don't want to go there. I don't want to look down there. I have a lot of shame or even a bit of fear about that. And I tell this story because not to say that like, oh, it's so bad that you haven't seen yourself in 25 years, but that this is really common, and it's something that so many of us live almost our entire lives without having a connected and intimate relationship with this part of ourselves. And I think that the reason for that is very vast. I mean, we could talk about the trauma that we've experienced that has made that area, that part of ourselves not feel safe. We could talk about the culture that we live in that has really indoctrinated us to believe that this is a part of ourselves that should like not be seen, close your legs, make sure you're not smelly, all of these things that we've internalized about ourselves, as well as sort of like self-image, things that we've seen in porn, like this idea that our labia should look a certain way or that we should be hairless. So there's so many stories and so much narrative that goes on within us about this part of ourselves. And so as we're having this conversation today, I just really want to invite folks to think about what relationship do they have with their vulva? What relationship do they have with their vagina? And not ask or answer that question from a place of judgment, just to be curious about like, yeah, when was the last time I took a mirror between my legs and saw what I looked like? Or when I think about, putting a finger in there, not in a sexual way, but just to be like, it's my body. I can put my finger in my ear. I should be able to put my finger in my vagina in the same benign way. Like what comes up for me? So I just want to bring that into the conversation because it's really easy for us, like me and Kate, to talk about these things because we do this work and it feels really easy. Yeah, it feels really easy for us to like access this information, but for a lot of us it's not, and that's okay.
I really appreciate you saying that, Evian, because it's so important. And I think I just want to add one little piece to that, because of all of the messages that you mentioned and the relationships and ways in which we're socialized to relate to our own bodies. We often experience our vulvas and vaginas as these compartmentalized elements of our bodies, right? Whereas the rest of our body is part of our body, and then there's the genitals over here. So another invitation maybe is to think about, are you inclusive of your genitals when you think about your body, or do they feel like a foreign entity? And might you be able to make some room for them to have a place on the whole gestalt of who you are, in your mind and of course in your body. And when we're thinking about being sexual and cleaning up after sex or using the V drops, might this be an opportunity for you to nurture that part of your body that may have been neglected or shamed or somehow cast out into this separate experience, this compartmentalized world that isn't really related to how you see yourself on a day-to-day basis?
I love that because, we have a hair wash, a conditioner, we pay so much attention. Oh, which brand do we buy? What ingredients are in there? And like, how is my hair? And what is, you put so much energy into your hair, which is basically dead. But, it's like, what do we do with our genitals? Yeah. And, guys are, luckier because they say hi to their penis every time they go to the bathroom. We never get to see our genitals. And I think, especially as young children, when you're 12, 13, and the mothers don't even know how to bring sexuality into a conversation. I think it's great if we start with the idea of hygiene. We drops, we wash. Let's talk about hygiene. And then it's a totally different conversation. And then all of a sudden you start a conversation with your teenagers about a topic you normally wouldn't know how to address. But that is like, okay, so how do we shave our legs? How do we do this? It's like, how do we wash our genitals? It should be just like one big thing. And I think it's an opportunity really with a collection like this to address these topics. And maybe you guys, even you were just like talking about vulva and vagina. Do you want to, point out what's the difference between, because people think vagina is vagina, but actually there's like the vagina and the vulva.
Yeah, I mean, first of all, like language is really important, and I don't want to shame anyone who is saying vagina when they mean vulva, but I do want for us to think about, particularly for women and people with vulvas, like to really think about the ways that we talk about this part of ourselves and to not dishonor ourselves by using the wrong name. So typically what we hear in, big media and things like that is, the vagina is everything. It's the vulva, it's the folds, it's what is down there, what is in your pants or in your underwear. When really the vagina is inside. So the vagina is the inner portion. It's like a sort of like a, I don't know if it's the right term is a tube, but it is basically what is internal. And the vulva is everything else. The vulva is what you can see when you're with your own eyes. So if you were to take a mirror between your legs, and you were to look at yourself, what you're looking at is the vulva. It's impossible for you to look at the vagina unless you use like some kind of a, what's it called? A camera, yes, a camera that can go inside of you. So what my politic as a sex educator is to make sure, as I said before, that we're using language that is accurate. And that, we correct people who might say like, hey, your vagina is blah, blah, blah. And, maybe that might look like, well, that's so interesting. You must have X-ray vision. I can't even see my vagina. And also to really bring in these aspects of education with our own children, because it's really important that we are using the right language for our body parts. And I'm pretty sure there are men walking around calling their penises penises and not prostates, for example. So it's really important that we challenge these narratives and like even check in with ourselves that like, oh, a lot of these people are using the wrong word. I wonder why that is. I'm going to honor my body and call it the right one.
Yeah, I think that's cool. I think that's really a good point. Should we talk a little bit about, what happens with the young woman and where are we going to when we come into menopause, and what are the challenges in all those different steps? Obviously, when we're young, we have a lot of sex. When we're older, our estrogen, gets lower. We have atrophy, cell atrophy, and then we have itchiness and dryness, and these are all things we can address with such a V collection as V wash, and especially the V drops. What is your experience when you in your work, in your daily work? What is the most challenging question you get asked, and the most challenging topic you sometimes wonder how to address?
Well, one of the questions that I get a lot through from people with vulvas and vaginas throughout the lifespan is, why is it changing? Why do I wake up one day and I notice something feels different or looks different? What is that about? And just like the rest of our bodies, our vulvas and our vaginas shift and they move and they change. They might experience, Dr. Sturm, as you mentioned, changes in hormones. And that can really, not always exclusively to menopause, but certainly it's really amplified during menopause. Changes in hormones can impact both the vulva and the vagina, and people can experience tissue becoming thinner, drier, less elastic, less flexible. It can feel sometimes very painful when the skin changes and there's not as much elasticity there during sex. So it can change the pH. Changing hormones can make the vagina less acidic, which, can also change the experience of touch and sensation. And it can really kind of create a disconnect for women or for people with vulvas in their bodies, because if you don't know what's happening or it doesn't feel comfortable and you already feel like that's not a part of yourself that you want to acknowledge, have the language to acknowledge, or feel permission to acknowledge and advocate around, then what I find is that people sort of further compartmentalize that experience and become more and more distant from their bodies. So they not only stop feeling embodied in their genitals, but in the rest of their body because something feels off. So they flee up here. They also become more distant from their identity as women because that disembodiment can really sort of create, again, a really alien experience with what's happening in the body. And it can make people feel less sexual, less sexy, and less willing to interact with a partner. Because if they don't have the words and their partner doesn't have the words or is less sensitive to what's going on, it can feel really scary and vulnerable.
Evian, you want to say something about, you want to jump in?
Yeah, I mean, I want to just talk about the vulnerable piece, about what it's like to have these stories and these narratives about your body, and you're also trying to have intimate experiences with other people, and how sometimes those things can be really complicated and really confusing. And I think one of the things that I teach a lot in my own work, in particular, not just the education of ourselves, but also an invitation to like bring that energy down. As Dr. Kate was saying a moment ago, sometimes we can just be all the way up here. Like, what does it look like for us to bring that energy down into our hearts, into our bellies, into our vulvas? And sometimes that can be really challenging. And I encourage people who might have experienced any form of sexual violation, sexual trauma, any form of sexual shame, either from culture or from people that were close to them. If there's any sort of relationship that you have with this part of yourself that just doesn't make you feel good, it's okay to talk to a therapist. It's okay to talk to a doctor. I think that one of the things that's coming up for me is how utilitarian we can treat this part of ourselves. It's like, I'm only paying attention to my vulva when I have a yeast infection, or when I have a UTI, or when I have sex. And so we have these very limited relationship with this part of ourselves.
And that's like negative.
And it's usually negative. I mean, unless you're having amazing sex, which is great, but I'm super holistic in that, like, I want for us to have a sense of continuity of this relationship with ourselves. And as I was saying a minute ago, being able to stick a finger in your vagina as simple as if you were picking your nose. Like, it doesn't have to mean anything. Right. It's just another part of your body that that is neutral, benign. And if you can't love that part of yourself, that's okay. But can you be neutral about it?
That's such a really great point. If we only see our vulvas and vaginas as something that needs to be fixed or addressed or made better, right, which is often what happens when we're getting treatment for a yeast infection, UTI, going to the doctor, or even getting a wax or something like that. We're always trying to improve or fix it. Or it's perfunctory, right? We're having sex, it's giving us pleasure, it's doing something for us. Or when we're having a child, it's doing something for us, giving birth. So we have to, I shouldn't say we have to, but I invite everyone to sort of think about, can your vulva and vagina be a part of you that is valid and worthwhile, even if it's not being used for something functional in the moment?
And I
So
also
I come
think
back to
about
what.
oh, go ahead.
You go ahead. You go ahead.
Okay. No, I was just going to say, when thinking about the V drops, it could be very easy to introduce this into your self-care routine, just as utilitarian as like, oh, I'm brushing my teeth or whatever, which is fine. I think that that's okay.
Yeah.
But if we are to sort of disrupt the relationship that we have with this part of ourselves, if we're wanting to bring a little bit more mindfulness and intimacy and curiosity about this part of ourselves, we can introduce something like V drops into our routine, where it's like, okay, I'm not going to just like slather it on and move on with my day. Like, what does it feel like for me to touch myself here? Not in a non-sexual way, but just more like, I'm giving myself care right now. And how does that feel? And to really invite yourself to create new systems, new relationships with your body in this way.
And that's really also the reason why I created it, that it's for us, you know. And I gave samples. When I had samples, I gave all these samples to my girlfriends, and they were like, oh my god, I cannot live without it anymore. I got totally addicted. So the idea of, you know, and there's so many things we don't really think about it, because it's so normal that, you know, there's dryness, maybe also from using tampons which are too long or too far outside, or, you know, there's always like a little, you know, micro injuries here and there which makes you like feel uncomfortable, or, you know, when you had sex and it's like micro injuries around, and or any type of you know, problem you had, maybe, or hormonal change or whatever, and you feel dry, or after a shower, anything, and you just use this hyaluronic serum based product. I show you how it looks. Actually, it's really beautiful hyaluronic serum based, and it's actually a tiny bit sticky. It's not too, because it's also important to keep bacteria out. Yeah, and it's great hydration and and a good hydrated skin barrier, together with lactobacillus, which is also in here, keeps the pH acidic, because the you know, vulva and the vagina's pH is very acidic. It's 3.8. This is not for internal use. This is really for our vulva, to use on our vulva. Also great after shaving, after waxing. I mean, there is so much care we put into this area, but then we have nothing to really apply after, and that's why the V drops are amazing, and the V wash is in our shower. And yeah, it's you know, when I started using it, I was like, okay, so I have my body wash, which I created too. By the way, I have a body wash coming out. It's not out yet, but I have a body wash for my body, and then I use this you know, for my vulva. And so you kind of just incorporate this into your shower routine, and then in your skincare routine, it becomes like a thing, you know. It's kind of really cool to have this extra step and put attention to it, like you put attention to your hair, or to your nails, or, you know, to every other part of your body.
Yeah. When I think about the added implicit benefits of doing that, of incorporating the V drops into your daily routine, I think about how much stronger the mind-body connection can become when we are touching, and touching without you know, any sort of intention behind it. Even if we don't want to be sexual, just sort of touching our skin, we develop more somatosensory awareness internally. So implicitly, our brain starts to pay more attention to the sensations in our vulva when we use drops like this on a daily basis, which can over time increase things like sensitivity to other kinds of sensory experiences, whether pain or pleasure rooted, because your brain and your vulva are developing a fluent conversation with each other. And that's really helpful to stay more connected and embodied. obviously increase pleasure potential, and also get ahead of things like infections because you're more aware of what feels typical for your body on a daily basis when you're engaging in that kind of touch. So this is a really ingenious, implicit conversation that you've started, Dr. Sturm, with this product. It gives people with vulvas so much more, I think, information in their bodies than even we could put words to.
And it's so great to talk to you guys because I learned so much more, because for me, skin product, now it comes a totally separate topic with it, which is super exciting for me to learn more about. And it's fantastic to bring even more aspects into everything. So yeah, let's totally brainstorm more on that. I think, this attention in this area is totally needed, I guess, because also let's talk about aging. There's a whole nother topic in this area, aging. Above my clinic here in Düsseldorf, there's a clinic of a guy who's specialized in anti-aging of the vulva and vagina. It's like, okay. And he's restitching the, I don't know, human, he's, doing all these things for, anti-aging. And if we give ingredient science, to our parts, that also helps with anti-aging, hydration, purslane for telomerase activating, but wound healing and anti-inflammation. Inflammation is another big part of getting infection plus aging. And we can, take inflammation down by using, good ingredients in our skincare routine. So yeah, the aging part. Do you have patients who come to you and say, what, I feel old, I don't want to have sex anymore just because, I look in the mirror and I just don't like what I see?
Yes, all the time. All the time I have patients say that.
Yeah. And I was just going to say, maybe I'm old fashioned, or maybe it's because I'm not older yet. I'm in my 30s, but I hear about these anti-aging things with your vagina, and I'm just like, what's so wrong with being
so
old?
Crazy, no? It's so crazy. It's so crazy. There's like a whole industry. It's a whole industry. This guy is busy.
Yeah, I bet. And I wonder to whose standard are we measuring what a anti-aged vulva looks like, And I think about that a lot as I've done some research about, I think it's called, I could be butchering this, maybe Dr. Kate, you can tell me, vagioplasty? Is that what it's called?
Labiaplasty?
Labiaplasty, yes. And which, for the record, like, I'm not shaming anyone who chooses to change a part of themselves that they feel not good about. I think that is our power and our right for us to be agents of change and to advocate for ourselves. But I always like to just ask for people to be curious about where that desire is coming from, and like, to whose standard are they measuring themselves against?
Well, that's really the quintessential question when we're talking about body sovereignty is, how are you coming to make this decision? And are you being influenced in ways that you are conscious of or maybe not so conscious of? And we all sort of grow up with messaging about all the shoulds or should nots that society deems appropriate. So it's important to really question, what is my goal with any body modification? Because I think a lot of people are doing it for aesthetic reasons, but and that can be okay. But are you doing it for your own aesthetic reasons, or because you're feeling pressured to conform? And that maybe is an opportunity to get more curious about what would it be like to challenge that, right? And stay with whatever feels like your organic path in life. But maybe it's not. Maybe it's about choosing autonomy and feeling autonomy in a body where maybe yours has been compromised historically. So I think there can be a lot of really wonderful ways to engage with the different anti-aging options that are out there, but really thinking and getting clear about, if I do this and I don't feel any different, will I still have made this decision? Is it important to me, or am I trying to change an environmental or external factor or reaction by changing something on my person. And you may still decide to do it, and that's okay.
Yeah, I think the important part is just to be curious, to ask questions, not from a place of judgment, but just like, where does this impulse come from? What stories might I have internalized that have led me to believe that this is a decision that I need to make? Yeah. And, you know, as you were saying, you might do all of this inner inquiry and feel like, I'm still good. I am so happy to go under the knife or to pursue anti-aging for my vulva, which is great. But I always ask for people to be curious, because we're often on autopilot. I think our culture like creates this habit of us to be like, oh, this ad says I should get this to make me feel better, I'm going to get this, rather than slowing the pace down a little bit and checking in with our inner compass and asking, does this apply to me? Do I want to adopt this into my lifestyle? I think that that's really important.
Yeah. Which is why I love the V drops, because they give you that moment of being connected to your body in the morning or in the evening, whenever you happen to do your skincare routine. It gives you that chance to check in a really authentic, what's the word I'm looking for? Non-agenda kind of way, just like, here I am, and this is my truth on a daily basis. And that gives you a lot more clarity if there's a decision later in life to make changes or not.
What do you guys think is the ABC of intimate hygiene?
Oh, that's such a great question.
That is a good question. I mean, I think that simplicity is better than doing a whole, I mean, I know so many of us are like, have like 12-step or 15-step skincare routines. I would say keep it simple for what's going on down there. There's just such delicate skin. There's such a delicate, just like bacteria that are healthy for you down there. You don't really want to do too much. I think that something like the V drops would be good for that, and just like keep it there. I worry about people who are like, well, if I do this, then I need to get this, and I need to get this. It's like there's a reason why we
that wouldn't be good. I think that wouldn't be good at all. I think to overpowering this. Oh God, I think it's just like, I think just quite the opposite. I think less is more, and I think personally, you shouldn't use soap because it's too alkaline. You shouldn't use fragrance products, shower gels. Like, I think it's quite, normally you go in a hotel room or you're at home and, there's any shower gel, whatever. So maybe we don't pay enough attention and we use anything which can already, disturb our pH and therefore our microbiome in this area. And I was wondering, so maybe, what would be like things we have to pay attention, not walking around in wet, bathing suits, for example. I think now the summers and, we are on the beach or in the pool or doing like, water sports. And, we tend to just have our bikini dry off on our bodies. And I think that is one of the situations where I think we should better change, because the dry gets stuck on our vulva and can, cause, infections right there. Also, not wearing too tight jeans, not too tight clothes, not too, air should always come. Obviously, we should, change our underwear on a daily basis, maybe
go without underwear.
Yeah, I was just going to say, I'm a big fan of.
People probably don't. I don't know.
I'm a big fan of encouraging people to find times to go without underwear and wear like a skirt or loose shorts, loose pants at home, so they can create an opportunity for their vulvas to have air, fresh air, movement around that, and to not feel so confined by undergarments and tight clothes.
Yeah, I also think for folks who might get chronic UTIs or chronic yeast infection or bacteria infections down there, it would be worth your while to look at what underwear you're wearing. We are so sensitive. I think a lot more sensitive than we realize. And oftentimes the missing link in terms of trying to figure out like what is going on. I've tried everything, all these antibiotics, and I still keep getting these infections. You might look into your underwear, because that is like the one part of us that is being made with or having contact with some form of fabric every day. And so I would recommend staying away from synthetic fabrics. I would recommend incorporating natural fabrics that are breathable, like cotton.
Like cotton. Also, you can wash, you know, some things it wouldn't be, even if you only wear La Perla, I mean, you have to hand wash. That doesn't make any sense. I think you need to have like a proper washing possibility. So cotton probably is the best, maybe not too lacy, right?
Right. It's one of the reasons why I'll just say it here, I hate lingerie. I mean, I think it's really beautiful to wear for a minute and then you take it off and have fun. But the idea of wearing thong underwear or something that's really lacy, I mean, those things, again, create a lot of contact with us. It's also very restricting, not very breathable. So, you know, if you're home already, we're all still kind of in quarantine until things get back together. This would be a good time to explore, like, okay, what does it look like for me to not wear underwear today? Or embrace the granny panties. I personally love granny panties.
Yeah, they can be a lot of, they can bring a lot of joy at home, and really they're more comfortable for sure. But I think coming back to your question about the ABCs, like one of the things that really stands out to me is being intentional and paying attention to ingredients. And like you mentioned, the fabrics that go near your body, and just sort of your day-to-day practices and being intentional, just like you might be about how you brush your teeth and getting a nice toothpaste that really aligns with what your goals are and allows you to have fresh breath and take care of plaque. Investing in creating contact with clothing that really aligns with your body's needs in that area of the body is helpful. And also allows you to feel comfortable or sexy in a way that you define it. And so being able to be attuned to your body maybe would be another part of those ABCs. Just give your body some attention periodically and notice what it needs. Notice what it's telling you. Strike up a conversation between your mind and your vulva, and let them talk back and forth so that you can adjust and you can find time for lingerie and the granny panties and have balance and love for yourself in both.
Yeah.
Another thing I think is, like, you know, people like to put fragrances everywhere, you know, especially before they see their boyfriend, and, you know, and I think what we also cool to encourage women also to be natural. Also, you know, the natural body scent also is attraction to the male partner. And we think, oh, it needs to be like, you know, Dior or whatever perfume you're using. And it's like, you know, maybe we have to identify with our bodies even stronger and feel like, you know, good in our bodies, no matter, you know, what fragrance and how we smell. You know, I stopped using fragrances altogether, just really, really rarely, because I just got so away from all scented stuff. I cannot even tolerate these crazy strong scents anymore. And you know, my entire skincare routine, it's all unscented. And I think it's so much better for our skin and for our body to not have these crazy scents. And it's, I think, the same with you know, with our, you know, intimate area, but also with the washing detergents we use. You know, it's like, it's so strong even in our underwear. If there's so much detergent in, that can also disrupt our natural flora in this area. What do you think about this, like, you know, scent, you know, body scents, natural versus fragrance?
I mean, I'm not a physician, but I think that there's a lot of benefit in really kind of harvesting what is organic in your own body and not introducing too many confounding variables, which a lot of scents, especially chemically derived scents, can smell great initially, but the way that they mix with your body chemistry or the influence that they have in the natural neurobiology between two partners can really create a lot of competition, if you will, for sensory satisfaction. And I think sticking with things that are more organic and natural or even unscented is probably a safer bet, because it allows the robustness of your own smells and scents to be alive. And we continue then to reinforce that attraction between partners instead of these like artificial allures.
Yeah, I mean, I would add to that like it's really important to destigmatize the way that your body smells like. Like my vulva is not going to smell like forest rain, and neither should anyone else's. It's not natural for our vulvas to smell like that. So what does it look like for us to embrace the way that we naturally smell like? And I know that culture, people have taught us numerous things about the way that we should smell like, or the way that we shouldn't smell like down there. And I think that has, for a lot of us, bred some self-hatred and some fear about, well, if I don't, I shouldn't smell like anything then. Or I've even heard of people taking shots of like pineapple juice to try to change the way that their vulva smells like. And yeah, I really want, again, kind of coming back to what we were talking about earlier, like, where does this come from? And is this something that you actually want to be subscribed to? Like, do you want to feel like, in order for me to have a good time sexually with someone, that my body has to smell like a flower all the time? But that's not natural. We're animals. We're supposed to smell a little funky.
So true. And I rarely hear people with penises walking around trying to think about ways to make their testicles smell like, a spring shower. And when I really started thinking about that, I thought, well, why are people with vulvas being sold this double standard and this false bill of goods? So I really think it's important to look at, how did we come to believe what we believe about how to care for our bodies? Because so much is ingrained in ideologies that are frankly outdated and not helpful.
And sexist, I mean, I think about all the cis men walking around, not having washed their parts in a week. And they're telling us that we should smell like forest rain. So I just really want for us to think about where this stuff is coming from and who it's coming from.
Exactly. Yeah.
Totally agreed. So I know, Kate, you have a hard stop. Is anybody in the audience to want to join the conversation? I have a question. If not, I think
we should have Laura on the line. Laura, if
okay,
you're there,
cool.
Just
hi, Laura. Kate, if you have to go, you just drop out. I just want to keep. Hi, Laura. How are you?
Hey, fine, thank you. So nice to see you again. I'm so sorry because I'm too present in your life, Dr. Sturm.
I like it. We're very happy to have you.
Interesting conversations, so I can't, I have so many questions, but the first one is that I suffered from a recurrent cystitis. How do you call it?
Cystitis, yes.
Yeah. And so my attention to hygiene is very high. So every time I go to the bathroom, I always rinse off and I noticed that my vulva was getting very, very dehydrated and very, very, dry. And so I have a question: how often I have to use the serum, the V serum?
The V drops.
Yes, the V drops. How many times a day?
So that is really up to you. What I would do, I would try to keep the area hydrated. If you rinse too many times, that could also dry it out more. So rather than rinsing, you take a shower once a day or twice a day, but not more. I don't think that's necessary. But this is, against dryness. And as I just said, especially when we, go through our period of life where estrogen gets lower, our cells start to atrophy, and the dryness comes by nature, not even what we put on our vulva. It's really important to add this hydration, and that's why I think, especially for women like you, it's great to have this
I have it.
Just to and it would be great to give feedback about what you feel like further down the line when you started using it for a little longer. But I think that must be helping you tremendously. And just only use this to wash when you take a shower, but I wouldn't rinse all the time. I wouldn't overdo it, because, that definitely can cause some dryness too. I really would be very interested in seeing how you get along with it.
Yes. Okay.
I do need to take off right now, so I just want to say goodbye to everyone and thank you
Good to see you,
for.
Kate. Thank you so much for
Thank you.
being part today. It was so interesting. Thank you.
Likewise.
Yes, it was so good to meet you, Kate.
Likewise. Take care. All right. Bye, everyone.
Bye.
Bye. Vivian, do you want to add anything to Laura's question?
No, I think what you said really addressed it. I think we can get into this habit of overwashing, to be over hygienated. And there's a reason why we call the vagina a self-cleaning oven. Like, you don't really have to do much to it. And so less is more, simple is better. And it's also important to just like monitor, like, what is it like for me to only wash myself once a day? What is it like for me to wash myself a couple of times a week? Like, what changes in my body, in the consistency of my discharge, whatever, just to sort of treat this as kind of like a science experiment, because every body is different. And to apply a one size fits all model to your body, maybe it doesn't work.
Yeah, also if we rinse too much, our microbiome gets probably disturbed a little bit. And, it's always good to keep this area also alone for a while. Less is more, from the less the very best, and the stuff which is good and not disturbing this area. So Laura, I think you're good. You have those products, use them and follow our advice, and then let's reconnect and see how it's going.
Yes. Okay. Thank you.
So nice to see you.
Nice to see you too. Bye.
Ciao.
Ciao.
Shivi?
So that's all we have at the moment. We have actually had some other questions. I don't know if you want me to just read them quickly.
What if is something you would like to talk about? What is something we haven't touched on yet? You're such an expert. I want to refer to you to maybe add to anything you think we need to know as well.
Yeah, thank you. I think one thing that's coming up for me, it's just, we're spending a lot of time talking about the vulva and vagina, which is great, but we also need to give our pelvic floor and our pelvic area some love as well. And I think one great way to bring more continuity to this part of ourselves, more body-mind connection to our vulvas, is by doing things in that area of a non-sexual way to create a relationship with it. And one of my favorite things to do as kind of like, it's like a multi-use thing. It can connect us to our bodies. It can also shake out some tension and stagnation in that part of ourselves. And it's also a lot of fun, is doing shimmying. Shimmying is a really, really great way. So shimmying, should I show you?
Yeah.
Okay. So shimmying is basically just shaking your hips.
How cool.
Yeah. And the way that you do this is you stand on 2 feet. You put your feet maybe hip width distance apart, maybe a little bit wider, and you just alternate bending one knee and the other. And that creates that shimmying motion. And you can go fast, you can go slow. It's really important that you go slow at first, because if this is something you haven't done before, you want to warm your body up to it. We don't want you to hurt yourself. But what I like about shimmying is that it really helps to release a lot of tension that we hold in our pelvic floors. We hold so much here, I think more than we realize. And so shimmying is a really great way to bring some motion and movement into that body, that part of the body. I also am a firm believer that energy as well gets stuck here. It's not just the muscles and the ligaments and all of those things. It's also energetic. Like I think about trauma survivors and how we have experienced violation down there, and that violation can be trapped the energy of that violation can be trapped down there. The stress of that violation can be trapped down there. And so shimmying is a really great way to just bring some movement and some motion. You could, another way you could do some motion down there is just doing some little gentle hip circles when you're sitting, just to bring some movement down there, as well as bringing some mind-body connection. So I recommend turning on like a good song that you can shake it to. And just, you don't have to do it forever. You can do it for 3 minutes. You can do it for 30 minutes. But I have a lot of fun with it. I think it's a really great thing to introduce into your practice. Maybe after you put on in your V drops, you know, you can give it a little shimmy and
cool.
feel
I love
really
this.
good about it.
So yeah, why don't we get this ritual in there? I think this could be part of the routine.
Yeah.
So why don't you give us a little video? I think that is really cute actually, and it makes so much sense.
Sure.
Another thing, yeah, that you definitely should give us a video. I think that should be part of the routine, like a little shimmy. So another thing I think is also cool, and I love doing this almost on a daily basis, is Pilates. That is probably also really good for this area because it strengthens your pelvic, your muscles, your tendons. I think it addresses like everything from breathing over strengthening. I think that must be something you would approve too, no?
I have actually never done Pilates, so I'm not the right person to ask. I mean, I'm a natural dancer, so I tend to gravitate toward gentle, easily accessible. I look at Pilates machines and I'm like, that looks like a torture device. So I'm not the right person. But I will say, if you're doing something that brings you joy, and that's Pilates or running, go for it. You know, I think it's about what we're talking about here is not, it's bigger than the V drop. It's about bringing loving awareness and compassion and acceptance to your body, your whole body. And I think that something like adding V drops into your routine can help do that in a really beautiful way.
I agree. It's great. I learned so much. Thank you so much. That was fantastic, because as I just said, for me so far, I was just like only these two products and the science around it, and it all makes sense, but this makes way more sense what you're bringing to the table, and we will incorporate all of this in, you know, the way we talk about it. I think this was so insightful, and yeah, let's find this little piece of you know, routine from you added to our V collection. I think that would be great. Amazing. Yeah, so cool. Thank you so much. I'm a big fan. And yeah, everybody check out the podcast. How can we find, how can we subscribe to your podcast?
Yeah, so my podcast is called The Sexually Liberated Woman. You can find that on Spotify, Apple Podcasts, Stitcher, pretty much wherever you find podcasts. And you can also follow me on Instagram at evian.whitney. I even have a video actually on my Instagram. You'll have to scroll a little bit to find it, about shimmying and teaching people how to do it in a really fun way.
Cool. Let's do a new one with the V collection. I love it. Okay, everybody, I hope you like this. Maybe give us some feedback, what you want to learn more about. I loved our V school, and see you next week for Skin School. Bye, everybody. Good night.
Bye, everyone.
Bye to LA. I miss LA and I miss you. Big kiss.
Yes, come back.
Yes, soon. Ciao.